We can all improve our sexual performance and enjoy healthier sex. In this video, we're going to see everything about how to enhance erections and the musculature of the penis and vagina, so it's useful whether you're a man or a woman, but it's not for you if you're under 18 years old. I'm Dr. Melani Rubio, a urologist with over 10 years of experience specializing in sexual health, and today I'm going to explain the actual physiology of erections, what affects them, and most importantly, what you can do starting today to dramatically improve your sexual performance, your erection quality, and your overall satisfaction in intimate encounters. The first step to improving an erection is understanding what happens during one, understanding the steps that occur in your body, and everything that can negatively affect these steps. Let's see the steps and let's see how to enhance them, how to improve them. The physiology of an erection in both men and women. Yes, of course, women have an erection, which is the erection of the clitoris, can be broken down into the nervous system activating the mechanisms linked to erection, blood reaching the area with your arteries dilating and filling the corpora cavernosa of the penis or clitoris. And third, that the blood doesn't leave so the erection is maintained. In many cases, this happens as a consequence of sexual stimulation, but it's not the only situation that can generate an erection. Your nervous system has many processes that you don't control, what we call the autonomic nervous system. The autonomic nervous system that activates us and helps us survive is what we call sympathetic, and the autonomic system that helps us sleep, digest, or reproduce is what we call parasympathetic, which also gives us erections. For an erection to happen, we need to inhibit the sympathetic system, prevent its activity, and stimulate the parasympathetic. This means that if you're nervous, with high levels of stress, sympathetic activity, and cortisol in your body, you're going to have a lot of difficulties having an erection. This happens super frequently in people who still don't have experience. Therefore, the first step we need for good erections and better sex, whether you're a man or a woman, is to inhibit the sympathetic system. For this, we can meditate, we can improve our sleep quality, we can use some method of vagus nerve activation as you saw in my previous videos. But the problem here is that most of us have such bad energy levels that when we inhibit the sympathetic and stimulate the parasympathetic at night, we're going to get sleepy, negatively impacting our sexual performance. This is the typical scenario of someone who finally relaxed after a long day of work, and instead of desire feels tiredness and wants to go to bed. All this means that we have to improve our energy levels on one hand. On the other hand, we have to inhibit the sympathetic system, or be intelligent and choose the time of day when we have the least sympathetic activity and the most energy. These moments are usually moments of more energy and less stress, and the correct timing is essential for good sexual performance. If we think about our circadian cycle, the ideal moments are in the afternoon when we still have energy, and especially on weekends if your stress level naturally falls, and in the morning if you don't have a routine that stresses you. And if we talk about nighttime and you usually have dinner and tend to be tired, it's convenient to have sex before dinner. And then we have blood flow. The activation of the parasympathetic system causes the smooth muscle of your arteries and corpora cavernosa to relax. This effect is not minor. Blood flow to the area prior to erections increases 20 to 40 times in men, and a bit less in women. Let's understand one basic thing. If the blood that reaches your corpora cavernosa is restricted, because your blood vessels function poorly, because they're hardened by atherosclerosis and can't dilate, or for any other reason 40 times more blood flow isn't going to reach the area. This means the erection will take longer to happen and will be less complete. You probably never thought that the urine you have in your bladder and the fecal matter you have in your rectum affect sex and affect your erections. But they do, and a lot. The rectum that accumulates fecal matter is located behind the prostate and the base of the penis. The bladder is above the prostate. Both the bladder and rectum, when they're full, occupy more space than when they're empty, because they distend. The concept is simple: a limited space in your pelvis, because you have a full bladder, or a fuller rectum, means more resistance for the arteries that reach those areas to carry the necessary blood. In constipation, for example, where the rectum is full of several days' worth of fecal matter, the rectum is pressing on those arteries that should carry blood to the penis. You'll have an erection anyway, but it will take longer to be complete or will require more stimulus to happen and to be maintained. For all this, the advice I give you is empty your bladder. It's much easier to empty your bladder completely if you urinate sitting down than standing. Moving your hips forward and backward can help you eliminate those urine residues that may have remained. And the second advice, obviously, is to empty the rectum before having sex. For this, we can have a bowel movement beforehand. If you have difficulties, eat more fiber, eliminate foods that constipate like dairy, use abdominal breathing, and elevate your knees when you have a bowel movement. How do we use this information so it's not just information? First, we stay well hydrated to not decrease blood volume. Second, we improve our aerobic capacity with high-intensity interval training. Third, you can avoid any increase in internal pressure that makes blood filling difficult, like gases, abdominal distension, fecal matter in rectum, or full bladder. And fourth, you can make sure you have all the conditions in place for relaxation of blood vessels to happen. For this, it's important to maintain good values of some minerals like magnesium, potassium, or zinc, and also good values of nitric oxide. When the corpora cavernosa of the penis or clitoris grow in size, the outermost part, called tunica albuginea, presses against the veins and compresses them. Therefore, the more the corpora cavernosa grow, the easier it is to retain blood in the area. But this is only half the story. The rest of the venous compression is done by two absolutely key muscles for your erection, the ischiocavernosus muscle and the bulbocavernosus. The ischiocavernosus is the most important muscle for your erection because the distal part compresses veins. It's that simple. The more strength this muscle has, the more tension it can generate, the easier it is for you to sustain the erection. The bulbocavernosus helps carry blood, also to the spongy part of the penis, and helps your erection to a lesser extent. But ancient anatomists called it the accelerator of urine and semen. It helps you compress the urethra to eliminate the final drops of urine, and also helps you eliminate semen. And in women, the bulbocavernosus serves to contract the vaginal entrance, which makes training it in women make even more sense to improve performance and satisfaction. If the strength in these muscles isn't sufficient, the last part of the erection will be harder for you, and you'll feel the glands much softer than the corpora cavernosa. And if the erection loses intensity from physical exertion, or loses intensity in a short time without stimulating it, these muscles should have greater muscle tone. Therefore, if any of this happens to you, you have even more reason to train them. What I recommend you do to train this is Kegel-type exercises initially. In these exercises, we seek to elevate the anus as if you were holding in gas. We seek to do 3-second contractions, holding the muscle contraction and resting about 45 seconds. Do this exercise about 12 repetitions every day. Little by little, you'll gain more strength and you'll be able to increase the contraction time. In women, Kegel exercises can be trained using objects with different weights, where the goal is to prevent the object from leaving the vagina. Training these muscles in both men and women results in more satisfying sex and better sexual performance for both. We don't need to have erectile dysfunction for it to be worth knowing the possible causes. First, we have depression. Depression affects our erections because it affects our sexual desire. Second, we have alcohol consumption. A small amount can improve performance if we're stressed, but if we overdo it, this prevents the release of neurotransmitters necessary for erection. The third element is obesity. Obesity worsens erections because it makes it difficult for sufficient blood to reach the pelvis. The fourth element is elevated cholesterol and atherosclerosis. These causes can cause hardening of the arterial wall. Fifth, we have nerve damage. This is often a consequence of prostate cancer treatment. Seventh, we have antidepressant medications and other drugs like finasteride that can negatively affect erections. And then we have diabetes, low testosterone, age, and sexual performance anxiety. To solve this, Inhibit the sympathetic with the tools I mentioned before. Probably one of the most used drugs is sildenafil. What these drugs achieve is the dilation of arteries for longer. The obvious advice is to optimize all the other tools first. Reduce your sympathetic activity, increase blood flow, and train your musculature before using this type of drug. And the true messenger of your erection is nitric oxide. We can increase nitric oxide by eating foods rich in nitrates like beets, celery, or spinach, and use antioxidants like glutathione or vitamin C at the grade. Supplementation level, we can use L-arginine, or better yet, L-citrulline. And don't use mouthwash because beneficial bacteria in your mouth convert nitrates into nitric oxide. Also, keep in mind that pornography-induced erectile dysfunction exists. It happens as a consequence of exposing ourselves to too much stimulus. It progressively generates a desensitization. The test is to compare the erection when you masturbate with adult content versus without any content. If the erection was more difficult without content, you could have pornography-induced dysfunction. In that case, stop using it right now. And one of the most frequent questions is whether there's a limit or an amount of sex that negatively impacts us. The answer is no. There's no justification or evidence for semen retention. There's no amount of orgasm that can harm you. In fact, people who ejaculate less have more risk of prostate cancer. To improve erections and sexual satisfaction, you need to reduce sympathetic activity, calm down, and be rested. Empty the rectum and bladder for better performance. Help blood flow by increasing your nitric oxide with diet, with supplements, or doing aerobic exercises. And train the perineal muscles to keep blood where it should be. And if you like this video, one way to support the channel is to subscribe and give it a like.